This is to briefly describe the blood supply of the heart. Here's the outline of the heart: left border of the heart, the apex, a notch representing the interventricular groove, inferior border of the heart, and the right border, formed by the right atrium. It receives the superior vena cava. This is the opening of the superior vena cava, and inferiorly is the inferior vena cava. This is the outline of the right atrium, atrioventricular groove, and on the left side is the left auricle. Arising from the right ventricle is the pulmonary trunk, and arising from the left ventricle is the ascending aorta. This is the aortic orifice here, and it is guarded by the aortic valve. The aortic valve is a semilunar valve. It has three cusps. One of these cusps is anterior, and there are two other posterior cusps. This is, of course, anatomically speaking. Behind each of these cusps is a sinus, and from two of these sinuses coronary arteries arise. There is an anterior sinus here and the two posterior sinuses. This is the right posterior and this is the left posterior, from which the left coronary artery arises. The right coronary artery arises from the anterior aortic sinus, passes between the pulmonary trunk and the auricle of the right atrium and the right atrioventricular groove on the anterior surface of the heart, goes down until it reaches the inferior border of the heart on the inferior surface of the heart. I'm going to draw it now interrupted because it is on the inferior surface of the heart until it reaches the crux of the heart. On the anterior surface, the right coronary artery provides a right conus branch that supplies the infundibulum of the right ventricle. The right coronary artery also provides the SA nodal branch, which supplies the SA nodes. The SA node is located in the right atrium to the right side of the opening of the superior vena cava. The right coronary artery provides anterior ventricular branches to the right ventricle. Also, it supplies atrial branches to the right atrium. Close to the inferior margin of the heart, what is called the acute margin of the heart, the right coronary artery provides an marginal branch, which is called acute marginal branch or right marginal branch. This marginal branch passes parallel to the inferior border of the heart, supplies the right ventricle. In fact, it is a long ventricular branch that supplies the right ventricle, but it does not reach the apex of the heart. On the inferior surface of the heart, the right coronary artery provides a posterior interventricular artery that passes into the posterior interventricular groove. The remaining part of the right coronary artery continues behind the crux of the heart to anastomose with the termination of the circumflex of the left coronary artery. On the inferior surface of the heart, the right coronary artery provides ventricular branches. There are some also atrial branches, and before reaching the crux of the heart, the right coronary artery supplies a small branch that passes into the interatrial septum and supplies the AV node. The posterior interventricular artery supplies ventricular branches to the right ventricle, small ventricular branches to the left ventricle, and also it sends septal branches to the interventricular septum. These septal branches supply the inferior third of the interventricular septum. Now let's draw a cross-section of the heart that passes through the right and left ventricles. This is the outline of the left ventricle. It is almost circular, while the right ventricle is crescentic in shape, has thinner wall than that of the left ventricle, and you notice here that the interventricular septum has the thickness of the left ventricle. The marginal branch of the right coronary artery can be drawn here, and the posterior interventricular artery can be drawn here on the inferior surface of the heart. This posterior interventricular artery supplies ventricular branches to the right ventricle and small ventricular branches to the left ventricle. And also it sends branches that pass through the interventricular septum, but these branches are short and they supply only 1/3 of the interventricular septum. Now I'm going to deal with the left coronary artery. The left coronary artery arises from the left posterior aortic sinus and runs for a short distance between the pulmonary trunk and the auricle of the left atrium. Then it divides into two main branches. One of them goes around the heart, and this is called the circumflex branch. Now I'm going to draw it dotted because it is behind the heart, and this is the one that anastomoses with the termination of the right coronary artery. The other branch passes into the anterior interventricular groove and around the apex of the heart to meet the posterior interventricular artery. The anterior interventricular artery is also called the left anterior descending artery, LAD, while the posterior interventricular artery is also called the posterior descending artery, PDA. The anterior interventricular artery supplies ventricular diagonal branches that supply the left ventricle. Also it supplies smaller ventricular branches to the right ventricle, a left conus branch that supplies the infundibulum of the right ventricle, and it also supplies septal branches that pass into the substance of the interventricular septum. These septal branches are longer than the septal branches of the posterior interventricular artery, and they supply the anterior 2/3 of the interventricular septum, including the AV bundle. Now I'm going to represent the anterior interventricular artery on this section of the heart. This is the site of the anterior interventricular artery. It supplies ventricular diagonal branches to the left ventricle, long branches, smaller ventricular branches to the right ventricle, and it supplies long branches, septal branches, that supply the anterior 2/3 of the interventricular septum. These septal branches of the left anterior descending supply the region of the AV bundle. This is the AV bundle located in the interventricular septum. The circumflex branch, as it reaches the left margin of the heart, which is called the obtuse margin of the heart, it supplies a marginal branch which is called obtuse marginal branch or left marginal branch, and on the inferior surface of the heart it supplies atrial branches, small atrial branches to the left atrium, also ventricular branches to the left ventricle, and it anastomoses with the termination of the right coronary artery. Sometimes, in about 1/3 of the cases, the circumflex branch either provides the posterior interventricular artery or provides an accessory branch that runs parallel with the posterior interventricular artery. In about 2/3 of the cases, the posterior interventricular artery is a branch of the right coronary artery, and this is what is called the right dominance. While if the posterior interventricular artery is a branch of the circumflex of the left, it is called the left dominance, or if the posterior interventricular artery is contributed by branches of both right and left coronary artery, it is called codominance. But the most common situation in about 2/3 of the cases is the right dominance, in which the posterior interventricular artery is a branch of the right coronary artery. Regarding the conductive system of the heart, it has been just mentioned that the atrioventricular bundle is supplied by the septal branches of the anterior interventricular artery. The SA node, which is located at the right side of the entrance of the superior vena cava into the right atrium, is supplied by the SA nodal branch of the right coronary artery, and this is in about 60% of the cases. The atrioventricular node, which is located in the interatrial septum, is supplied by the AV nodal branch of the right coronary artery, and this is in about 80% of the cases. In about 40% of the cases, the SA node receives an SA nodal branch that is derived from the left coronary artery, and in about 20% of the cases, the AV node is supplied by a branch from the left coronary artery, from the circumflex of the left coronary artery. Now let's deal with the venous drainage of the heart. Again, this is an outline of the heart. This is the outline of the right atrium and the appendage of the left atrium. Almost all of the venous drainage of the heart goes into the right atrium through the coronary sinus, which opens into the right atrium, and its opening is guarded by a small valve of the coronary sinus. The veins of the heart, in many situations, they follow the arteries, but they carry different names. In the anterior interventricular groove, there is a vein that accompanies the anterior interventricular artery, left anterior descending. This vein is called the great cardiac vein. The great cardiac vein winds around the left margin of the heart and accompanies the circumflex artery of the left coronary artery. On the posterior surface of the heart, the great cardiac vein receives a small vein from the left atrium called oblique vein of the left atrium, and it is at this point that the coronary sinus is formed on the posterior surface of the heart. The coronary sinus is a wide venous sinus that opens into the right atrium. The coronary sinus drains most of the blood of the heart. So the coronary sinus is formed by the union of the great cardiac vein with the oblique vein of the left atrium. The coronary sinus drains the other veins from the heart. There is another vein that runs on the inferior surface of the heart and accompanies the posterior interventricular artery. This is called the middle cardiac vein. Another vein runs parallel to the inferior border of the heart and accompanies the right marginal artery, and this is called the small cardiac vein, also drains into the coronary sinus. So the coronary sinus drains most of the blood of the myocardium. The remaining blood from the myocardium is drained by two other routes: anterior cardiac veins, which drain directly into the right atrium. They are small, 2 to 4 veins. They open into the right atrium independent of the coronary sinus. There are also very small veins that open in all chambers of the heart, and these are called the veni cordis minimi, or the smallest cardiac veins, or the Thebesian veins. We can also represent the veins on the section of the heart. In the anterior interventricular groove, we have the great cardiac vein. In the posterior interventricular groove is the middle cardiac vein accompanying the posterior interventricular artery, the great cardiac vein accompanying the anterior interventricular artery, and on the acute margin of the heart we have the small cardiac vein accompanying the marginal branch of the right coronary artery. The smallest cardiac veins open independently in all chambers of the heart. They are very small veins.